And not only to do that, but then to inform it by bringing translational research into the mix. So we have not only tremendous clinical work going on there, but clinical work that is tied specifically to translational research and understanding the nature and the cause of mood and anxiety disorders and emotional dysregulation. Remember, 10% of kids have behavioral sequelae that are associated with emotional dysregulation. This is part of another group that Ed and others are part of. Ed, Helen, Mayberg, and others, as you see here, are a group at Yerkes with Tig Rainey and many others. And so many people in psychology and neurosurgery are all working together on this. What you're seeing there are pictures in an operating room. This is an operating room with a person who has intractable depressive disorder that is not responsive to medications, psychotherapies, the combination, electroconvulsive therapy. But work at Emory is leading to, again, new treatments and new cures. In this case, deep brain stimulation of people with intractable depression. Helen Mayberg and her group are the world's leaders in this. Again, part of what Emory brings to Atlanta is world leadership in new treatments like deep brain stimulation, or the work of Bill McDonald and his people here, where what we're looking at here is transcranial magnetic stimulation, where instead of using electroconvulsive therapy, you're using a magnet to change the electric field in the brain, and it's been shown by Bill and his colleagues that this approach is a reasonable approach to treating certain forms of depression. Again, world-class treatments, leading-edge research being done in patients today. If we look at Andy Miller's group, what we have here is, with Dr. Miller and his colleagues, are the leading people that have linked the brain and the body together. Work done at Emory was some of the first work to demonstrate that the mind and the body are connected, some say by the neck. You can laugh at that one. But what Andy was able to demonstrate was that cytokines, things that are secreted by white blood cells, actually cause depression in some people. His group is also part of the group at the Winship Cancer Center and has been able to show the relationship between cancer-related fatigue and cancer-related sequelae that occur, and problems with memory in the brain, and again, these changes in activation of white blood cells. He's not only done that, but he's now done treatment trials where they're actually using compounds that were developed for immunology, compounds that were developed to treat autoimmune diseases, to treat depression. And soon, though I can't tell you the outcome, but I can tell you we're going to be very proud of Dr. Miller very soon when some of this work gets published, because it's really outstanding work. Again, Emory and Atlanta is leading the way. This is a picture of Mike Owen's group. Mike Owen's group is working in animals and also working in the laboratory to develop new compounds and new approaches to treat depression and anxiety disorders and psychotic disorders. And what we're doing is taking his work and then using our Emory Mood and Anxiety Disorders program to test these compounds and to test these advances, all within our department, all part of the community of Atlanta. So we talked about the fact that we're treating younger people, we're treating older people. We've developed new treatment approaches that are both novel and innovative, but also new medicines. The other thing that we're doing because of the Fuqua Center is we're doing applied evidence-based research with older individuals in partnership with the Georgia Division of Aging, with the Atlanta Housing Authority, with the Atlanta Regional Commission. So it's not just you develop these things in the ivory tower and leave them there. Because of some of the work that Bill's group is doing and the Fuqua Center's doing, we're able to take it and apply it. So what you're seeing here is something unique in Atlanta. We have one of the most important programs in mood disorders anywhere in the world. We are one of the leaders, and we will be the leader in these efforts because of all of us working together in the community. Let's talk a little bit about stress and trauma, because I think all of us have been touched by this. You know, just out of curiosity, raise your hand if you haven't been touched by trauma, if you haven't had a friend or a loved one who's experienced some type of traumatic event. Raise your hand. Not a single hand in the room's up. These are common, important issues. Kerry Ressler, he's the one that looks like he's about to graduate from high school in this picture in the center. Kerry and his group at Yerkes are really some of the leaders in understanding the biology of this. They've developed the best animal models to understand the circuits in the brain that cause anxiety, to understand the genes that are responsible for modulating those circuits in the brain. He's done it in animal models, he's done it in monkeys, and then they took that work down to Grady. Ann Schwartz is in the room tonight as well. And they took that work down to Grady and put together this wonderful collaborative effort down there in the community to study trauma and to do amazing work looking at the causes of post-traumatic stress disorder and looking at the genes that modulate fear and modulate PTSD, looking at trying to understand why some people can experience a trauma. Some people can go through an auto accident. Some people can be in war and be okay. But others will be damaged for life. Kerry and his group are pursuing the causes of that quietly, but probably in the largest effort ever done. They have over 6,000 people they're following. Then Barbara's group have the leading edge treatments for PTSD. Barbara is right now, she's working with the Institute of Medicine, she's working with the Department of Defense, she's working with the VA. And one of the things that she's been the leader in is the development of virtual reality treatments for trauma. Be it the trauma of rape, be it the trauma of violence or war. Again, we at Emory are leaders in this. And Barbara and her colleagues have also now developed a new acute treatment for trauma. It's being done in the Grady emergency rooms. And again, soon you'll see a publication about this that's going to make you real proud of being in Atlanta. Proud of what we're able to do working hand in hand at Grady. This is, of course, a brief picture of a variety of projects that Nadine Caslow is involved in. Nadine has spent her career developing new therapies to be done in the community, developing therapies and working with some of the most disenfranchised people. If we just look at one of the projects, this particular project called NIA, it's funded by the National Institutes of Mental Health. And what they did, Nadine and her colleagues developed a culturally sensitive program of therapy for African American women who've experienced domestic violence and then become suicidal. And what they were able to do is develop a program that stops these women from needing to feel suicidal, that gives them hope, that gives them a way out. Tremendous work, again, here in Atlanta, done by Emory researchers. So what you see again in trauma and in stress is that we have everything from the preclinical side to going out in the community and developing therapies and developing techniques that we can share with everyone in the community. This is a unique opportunity, and it's a unique place that does that. Let's talk briefly about substance abuse, and in particular, we're going to talk about kids. This is the wonderful work that Claire Coles and her group has done over the years. Claire just does it quietly, but she has tremendous programs looking at the developmental effects of fetal alcohol syndrome, smoking, cocaine use when the mothers are pregnant. But Claire didn't stop there. She then said, I've got to do more. So she's developed primary prevention interventions to try and keep mothers from using these substances. But then that wasn't enough either. And what she's done is developed remediation techniques for kids with fetal alcohol syndrome. Let me just show you a little bit of Claire's work. She has one of the largest and longest going longitudinal studies of what happens when children are born of mothers who drink and when they have fetal alcohol syndrome. And she's been able to do brain imaging work and has studied these people for 30 years. It's a remarkable endeavor and a remarkable resource. She's set up other things looking at the effects of tobacco. Nora Volkow, right now, the director of NIDA, believes that tobacco use during pregnancy may be more dangerous than cocaine use during pregnancy. Emory Research is responsible for looking at some of this and for understanding this. And because of Claire's leadership, she is now involved in alcohol exposure and nutrition programs and exposure studies in the Ukraine, bringing Emory and Atlanta work worldwide. These are examples of some of the innovations that have come out of Claire's laboratory. Games with virtual reality to help children understand how to avoid dangerous behaviors. Techniques, again, for regulating behavior of these children that have been affected by in utero exposure to these substances. And educational programs to help these kids that have these brain dysfunction, such as the Math Interactive Learning Experience, or MILE, so that kids with fetal alcohol syndrome get a chance, so that they can begin to learn mathematics and do stuff. Well, you know, years ago, my wife told me, you know, Mark, you got to cut down the length of your lectures, particularly when they're on weekdays. So I'm going to try and take Jacqueline's advice because she usually gives me very good advice. So I want to close with this. I really do believe the future in Atlanta is bright. I think that we really do have a unique situation in my new community, your wonderful community, where community partnerships such as the relationship that we've had over the years between Emory and Skyland Trail, and we hope to grow over time, plus philanthropy, plus the tremendous research at Emory, be it the partnerships that we have in psychiatry with the Rollins School of Public Health, be it our work together in the Cancer Center, be it the tremendous richness of Yerkes and the Psychoanalytic Institute, allow us to really do something special. We will, working together, transform care for our patients and their families. We have to do this. This is something that we're in a unique opportunity to do, and I think all of us working together will succeed in doing so. You know, in closing this lecture, I just want to, again, thank you, Mrs. Fuqua, for all you've done for this community, but also for raising awareness about the fact that brain diseases are legitimate diseases and diseases that require and mandate our attention and our treatment, and that there is no shame in having a disease of the most complex organ system in the body. Thank you for your leadership in bringing these two nice young gentlemen along with you on your ride. I really appreciate that. Thank you very much for your time and attention.
Great talk. I appreciate it a lot. On behalf of the clinical staff at Skyland Trail, I'm Dr. Ray Kotwicki, the medical director here, and I want to thank Dr. Rapaport for a stimulating and very informative talk. And please join me again for another round of applause. It's my privilege to be both the medical director at Skyland Trail as well as an assistant professor of psychiatry in the department at Emory. And my job is to ask the tough and pointed questions. Given that Tom is a media person, I expect them to be very dramatic and get to the heart of the matter. That all of you have had hopefully the chance to write down on your small index cards. And if you haven't done so yet, please take the time to think of a couple of questions and pass them over to the side of the aisles. And some of the Skyland Trail staff will be circulating around the room to collect them. I've got a couple to start with, and I would like to begin with one, Mark, about DSM, which we know that there's a new diagnostic and statistic manual coming out maybe within the next couple of years. And given the research agenda that you've outlined in your talk, do you expect that the way that we think of classifying mental illnesses will change based on things like biomarkers and genes, rather than really focusing only on symptoms?
Well, I think that's a great question. So, for those of you in the room, in case you don't know, the DSM is the Diagnostics and Statistical Manual. Terrible name. And it's right now gone through 4 iterations. And what it is sort of the nomenclature or the language that we use to talk about and define different types of psychiatric illnesses. It is about to go through a 5th iteration. Unfortunately, I don't think we're far enough so that in that 5th iteration, the work that we're doing with biomarkers or some of the other work will actually make it. In DSM-6, I think we're going to see a very different creature, because in DSM-6, what we're going to be able to do is say, oh, that form of depression that people are having, that's Andy Miller's form of depression. That's a cytokine-mediated form of depression. Or they're going to go, oh, this other form of depression we have is actually similar to what Helen Mayberg was describing. And it's actually one that's treatable by an intervention where we use things like deep brain stimulation. But I think that'll be DSM-6 rather than DSM-5, that we're going to be able to make those actual sort of biological correlates part of what we do. But the good news is that's coming, and that's going to come fast. I think unlike DSM-4, DSM-5 is going to have a very short half-life because our field is changing so rapidly, and we're beginning to understand, because of Carrie Ressler's work, the commonality between anxiety disorders and what the disruption in the circuits are. So we'll know the changes in different parts of the brain, particularly the amygdala, that are causing those disorders. So we'll define it very differently.
Thank you. Second question. This was a plant, I think, from one of the Skyland Trail staff, which I'm very proud of. And the question is this. Biologic treatments seem to be really helpful in a lot of the symptom reduction of mental illnesses. But what other strategies to help people sort of improve their lives, sort of like what we try to do at Skyland Trail, do you feel need to really be focused on in addition to medications and therapies that are biologic? Good question. Marshawn, I think you wrote that one.
Well, you know, oh boy, I'm going to get myself in trouble with this answer. You guys ready for trouble? Okay. As I said earlier, the mind and the body are connected by the neck, right? Anyone doesn't believe that, raise your hand. Damn, not a hand went up. Okay. I think that we do ourselves and our patients a tremendous disservice when we think of things as biological treatments or psychological treatments or psychosocial treatments, what we have to do is think about the whole person. What we have to do is think about that family. Heck, whenever I have a patient in therapy for depression, one of the first things I tell them is I say, look, at some point we're going to do family work. Because as you get better, you're going to change, and your worldview is going to change. And when that changes, we're going to be doing some family work because your family's going to be scratching their head and saying, what the hell did that guy do? I had a patient that I had to leave that I've been treating for many years in LA. When he first came to see me, he was institutionalized and had been institutionalized for the last 7 years. He had schizophrenia. He also had problems with substance abuse. I began to work with him, and I told him, and I told his family, because I wouldn't see him without seeing his family, that I'd be known as Dr. No. Faculty, be aware. No, but this poor man had developed schizophrenia when he was in his 20s and had been very disabled by hallucinations and also disabled by tremendous problems with alcohol and substance use. Over a period of working together for almost 6 years, we got him from being completely institutionalized to initially living in a halfway house, to living alone in an apartment, to getting back his driver's license, to going back to school. This is somebody that was ill for many years, institutionalized for many years. What allows that to happen is the healing of time and the healing involved in all aspects of it, psychosocial interventions. We had